Hello, a warm welcome to friends on Zoom and YouTube who have just entered the session for our talk happening shortly. Please take your time to settle in and make yourself comfortable as you tune in to the talk over the next hour and a half or so. Today's talk, Smiling in Our Silver Years, is organized by Sage Counselling Centre, and our guest speaker for tonight is Dr. Gabriel Lee from NUS. For friends who are joining us for the first time, this webinar is one in a series that we organize throughout the year. This is part of our public education program, and topics covered in the past include sleep health and depression in the elderly. We cover topics that are relevant to seniors to enhance their total well-being. Do follow us on Facebook for updates on our next and future talks. Good evening, ladies and gentlemen. A big thank you to everyone for joining us tonight to listen to tonight's webinar organized by Sage Counselling Centre. Tonight is very special. It is the Dragon Boat Festival, or for the Chinese, is the 端午节. It is also during this period, we have the chance to sample all kinds of dumplings. I don't know about you guys, but I know there are Teochew dumpling, Cantonese dumpling, Noya dumplings, Hokkien dumplings, and even dumplings from Hong Kong and Taiwan. Now, I hope everyone had their fair share of dumpling sampling. Now, tonight's topic is not about tumbling or food, but revolves around our oral health and aging. I'm sure many, if not most of us, are keen because we want to find out about how we can maintain a beautiful smile as we age. We hope you would be able to learn something and even share your learnings with your friends and family too. But before that, I know that there are some friends joining us online for the first time today. Please allow me to take some time to share about Sage Counselling Centre and what we do. As our name suggests, one of our key services lies in counselling, free for Singaporeans and permanent residents aged 50 and above, as well as their caregivers and family members. We are located at Jurong Point Shopping Centre, next to Boon Lay MRT station. Secondly, we have the Seniors Helpline Service that is accessible to anyone that has a phone, regardless of your location. Anyone who would like a listening ear can call in and share about your challenges with our trained volunteers, or simply just to chat is also okay. We also have public education such as today's talk. Next, a lot of our service involve volunteers. So if you are interested, we are also able to provide volunteer training. The next few services and programs are very popular indeed. We have the home maintenance service that offers free basic home maintenance and repairs for seniors who have a Blue CHAS card, are receiving community assistance, and are living in a 3-room flats or less. We do repairs such as fixing light bulbs, leaky taps, and more. We also have arts and culture programs and a reminiscent walk that brings seniors out to tour different cultural and heritage sites. We also have expressive therapeutic art and the Music Ambassador program. Okay, moving on. Please also note that we have an advisory on personal data protection. During this talk, photos and videos of you may be taken for publicity, training, and marketing purposes. We would also like to gently remind our audience of a few pointers. Attendees' video functions are disabled during the talk. Please also do not record this talk in sound, video, or photography, as the contents of this talk are subject to copyright or may contain sensitive information. If you have questions, please leave them in the chat box below, and we will try to pose the question on your behalf during the Q&A, which will be after our speaker has presented. We apologize in advance if we are unable to answer all your questions and seek your understanding. So for everyone who has just joined in, thank you for joining us in this webinar, Smiling in Our Silver Years, organized by Sage Counselling Centre. Without further ado, let me introduce our speaker, Dr. Gabriel Lee. Dr. Gabriel Lee is currently a lecturer with the Dr. Gabriel Lee is currently a lecturer with the NUS Faculty of Dentistry. He completed his postgraduate training in psychiatric dentistry and have been awarded a scholarship under the NUS FOD Academia Talent Development Program. His teaching commitments and research areas focus on geriatric oral health and also holds a clinical position in the National University Centre for Oral Health, Singapore, where he mainly serves the older adult population. Okay, now let me pass the floor to Dr. Gabriel. Doctor, the floor is yours. I'll stop sharing my screen now.
Thank you very much, Melvin, as well as to the Sage Counselling Centre. And a very good evening to everyone. My name is Gabriel, and as Melvin had just shared a little bit about myself, I'm a dentist, and because I'm very passionate about our geriatric oral health, or very passionate for our older adults, a few of us have actually gone on to pursue further training in what we call geriatric dentistry, where we focus on helping to see and manage the oral health problems of the older population. Today, the title of my sharing is called Smiling into Your Silver Years, and really is to help our listeners have a little bit of a better understanding of how oral health is still important, even in older age, as well as how you can, make sure that you maintain your oral health with whatever teeth you feel that that you still have left that are in good condition, how we can continue to keep them all the way, as well as also focus a little bit about some of the common oral health conditions faced by older adults that may creep up in older age, and how you can treat them, or what are some of the treatment options available. And of course, later on at the end, if you have any questions, I'll be very happy to try my best to answer them. So we'll just start here. Okay, so why do we want to talk about oral health and say that, even especially if you may be in your 60s, 70s, 80s, or even older than that, why is oral health still important? Firstly, I'm sure some of you, or if not everyone, may have heard that actually oral health is linked to the rest of our body. In fact, from the mouth, we are able to see and see a lot of the symptoms sometimes that may be connected with your overall health. For example, it's especially in recent years, there has been a little bit more research done into the link between gum disease and diabetes. I'll cover that a little bit later and explain how that link works. The importance of oral health is also necessary so that we can enjoy food, especially for us Singaporeans, and especially for days like these where we all want to eat bacang, right? We need to ensure that our teeth are strong enough to be able to chew the food. Our teeth are strong enough and pain-free to be able to enjoy a well-balanced diet. Of course, later on, I will also share a little bit more about diet and how we can still enjoy our food while at the same time protecting our oral health. And finally, as many of us like to do, to socialize, to spend time with friends and loved ones, having a good oral health and good set of teeth allows us to smile, speak confidently, and feel good about ourselves, especially if we want to spend time with other people and interacting with our friends. But of course, our mouth changes as we age. We know that, especially in Singapore, newspapers have always reported, especially over the last few years, that Singapore is an aging population. What does that mean? Well, two things. Number one, we have more and more who are living into older age. And at the same time, those of us who are living to older age also are able to keep our teeth. Maybe some of us may be bogey already and no more teeth anymore, or we may have lost a lot of our teeth, but we do see an increasing number of older adults actually, because of good oral hygiene and having seen the dentist regularly, be able to maintain a good set of teeth. At the same time, you may have heard of things like implants, bridge, crown, root canal treatment. All these a bit more complicated dental treatment may have been done for some of our listeners here today. And because of that, our patients' mouth, especially those in older age, have an accumulation of these complex dental treatment. And of course, at the same time, some of the medications that we take, for example, your high blood pressure medications, may lead to dry mouth. And that, in a sense, can also affect taste, can affect swallowing, and also lead us to a higher risk of dental decay. So, what is a healthy mouth? I show you this picture. It doesn't look like, a 25-year-old young, army boy's mouth who is very clean and very straight and white. But this is a patient of mine. I think, if I remember, he must have been in his 70s. And I would consider this a healthy mouth. Let me explain why. You can see that there are some fillings on his teeth. I wouldn't need to show it to you. You can see here on these little white patches, there are fillings. You can also see that at the front here is a set of false teeth, or what we call dentures. At the back, these very white ones, sometimes if you are able to tell, they are crowns. But why I would say that this is a healthy mouth is because his oral hygiene is very well taken care of. The gums are pink and healthy. The denture looks very clean and well maintained. And at the same time, we don't see any further decay, meaning to say that this patient is able to take care of his teeth, able to chew, smile, speak well. On the other hand, sorry to show such gruesome photos, but to just drive the point home, this is a picture of an unhealthy mouth. And really, one of the issues then is this is an accumulation, right, of all these bacteria and germs in the mouth, and it's not really cleaned away either by brushing or by seeing the dentist to clean it. And some patients of mine, maybe they lack the ability to maintain their oral health. Some surprisingly would say, I don't care anymore, I'm very old. So because of that, let me propose today, why do we want to make sure that our oral health is well maintained? Oral health is linked to a few of our systems. As I mentioned just now, diabetes can be an issue. It's also linked to things like heart disease, where we see this kind of inflammation and swelling in the mouth actually can give us higher risk of having heart issues. For the very old and frail, things like pneumonia, where the germs in the mouth are breathed into the lungs, can affect and give rise to lung infection. Of course, maintaining a healthy mouth can prevent things like tooth decay and also reduce bad breath. So I'm just going to go a little bit more into details of some of the common oral conditions or the common oral problems in an aging mouth or in an older person. And then, of course, tips on how to avoid or manage them. So I'll be sharing 4 problems today, very common, and just show you some pictures and explain a little bit on how we can avoid these. Of course, I'll cover decay. We'll look a little bit into gum disease. I mentioned just now with medications, it can lead to dry mouth. And then we will also talk about the issue of tooth loss, missing teeth, right? And how this can be solved. So dental decay, you do not need to answer, but I thought I would just ask some questions anyway, and for you to just guess on yourself, on your side. So the question is, of course, is it okay to eat sugary foods as long as I brush my teeth immediately after eating? Well, the dentist would tell you that this is actually false. It's not really recommended that you eat too much sugary foods It is not how quickly you brush your teeth after, but it's how quickly you eat the sugary foods. For example, if someone takes 5 minutes to finish a cup of kopi peng, compared to someone who wants to sip their kopi peng for 1 hour as they read the newspapers, right? Both can brush their teeth immediately after, but the effect is already because of the duration of time that you are sipping the sugary foods. So just something for you to consider, right? When you take your next sweet drink, it is good to enjoy, especially, if it's your one drink for the day. But take note that the longer the sugars spent on your teeth, the higher risk that your teeth can get exposed to decay. So just some photos, if you ever wonder or not sure what I'm talking about, I've drawn up some photos here. They come in different shapes and colors. So long as you see a hole, so long as you feel pain, it's better to see a dentist to have it checked. All these photos are variations and examples of how decay can look. But really, for your own self, if you do suspect that you might have decay, see a dentist. How does a decay work, or what contributes to decay? So I'll just go a little bit into the science of it so that you can appreciate how we can prevent it. Of course, you need a tooth in order for decay to happen. Of course, I mentioned just now, you need sugar. Bacteria in the mouth is the one that causes the decay. So this bacteria loves the sugar, and when sugar sticks onto your teeth or in between your teeth, bacteria in the mouth hinges or latches onto the sugar and starts to consume it, right? And as it eats away at the sugar, it produces acid. And over time, when this acid continues to remain on the tooth, it leads to the decay forming. So in order to prevent decay, what we normally recommend is to remove the sources of to remove these risk factors. Of course, you're not going to remove the tooth. You will want to either remove the sugar by not having any sugar, or easier to say is that you want to reduce the time I mentioned just now, 5 minutes versus 1 hour of sipping kopi peng, or to see the dentist, or to make sure you brush your teeth to remove or reduce the amount of bacterial plaque in the mouth. So either one of these risk factors, if you remove it, actually lowers the risk of you having decay by a lot. Because if you remove sugar, bacteria has nothing to eat. If you remove bacteria, there's nothing to eat the sugar. And if you quicken the time, then bacteria doesn't have so much time to make the acid to make decay on the teeth. So I mentioned just now, some of you might be thinking, I don't eat sweets. Like, I didn't mean to say candy or drink Coca-Cola. But this may be familiar to most of you, right? Sometimes we may take 3-in-1 kopi. You may like to eat kueh salad, which is very, very sticky and always cause a lot of problems. Things like peanut candy, right? The peanut is stuck together, of course, we know, by sugar. And other biscuits, right? Especially lemon puffs with the cream. When you eat it, it's very sticky. And so long as you know that it's stuck in between your teeth and you don't rinse your mouth, at least after eating, that causes the plaque to form. And a good meal, a good snack, a good treat for the bacteria to start forming the decay. So just keep in mind, it's good to enjoy all these foods. I'm not saying we shouldn't, right? But it's just important not to take too long to eat it, or at the same time, brush your teeth after you have finished eating. There are other ways to prevent decay from happening. So of course, to use fluoride toothpaste, things like anything you find in Sheng Siong, NTUC, or even if you like to go Cold Storage, it's up to you. Colgate, Sensodyne, Dali, all the toothpastes that we normally find in the supermarkets have a good a serving of fluoride, a good concentration of fluoride. So that would be good enough for your teeth. Of course, I mentioned just now to reduce the frequency and the duration of sugar. You can consider sugar-free alternatives if you are watching your blood sugars. Sometimes, if there is a need, for example, you may find yourself just more predisposed to having decay. How come my friend only got 1 decay every 5 years? I get 5 decay this year. See your dentist. Sometimes they may offer you other forms of things like mouth rinse or gels just to increase the fluoride. So why is so special about fluoride that I keep talking about it? Fluoride is a chemical or is an ingredient that helps to harden the tooth and kill bacteria in the mouth, lowering the risk of getting decay. Of course, if you end up having a decay, some of you may be familiar with this, having a filling done. There are silver fillings, there are white fillings. Most of them have their strengths. So sometimes if really the decay goes very deep, then you will see that you need to do a root canal treatment I won't go into detail now, but if you ever have that, you can ask your dentist to explain to you. It usually starts with pain. You see the dentist, they remove the nerve of the tooth and then they put a filling inside, finally capping the tooth with a crown. The second common issue that we see in older adults is gum disease. So another question that you can think to yourself, my gums bleed when I brush, so should you stop brushing? Well, by now you will know that I'm going to say the answer is false. You should not stop brushing. In fact, sometimes if your gums are bleeding, best to see a dentist first. Bleeding, of course, can be caused by two issues. One, of course, is if you are on blood thinning medications like aspirin, it may lead to increased risk of gum bleeding, and your doctor may have warned you about it. But more commonly, it is because if the gums are not well taken care of, there's a lot of food getting stuck in between the gums. And because of that, every time you brush now, there's a bit of pain. And then, of course, there's bleeding. Good to see the dentist to get it checked. So there are two common gum issues. One, of course, you may have heard is called gingivitis. Just to go into the science of it again, this is just swelling of the gums, easily treated by seeing a dentist for cleaning. The second one is called periodontitis. Sometimes your dentist may say, hey, I'm checking in between the gums and the teeth and it seems very deep. Or they may say your teeth are beginning to become shaky. That is when the bone that keeps the tooth firm starts to dissolve or starts to resort. And because of that, the tooth is now at risk of becoming more shaky. And eventually, of course, you may have heard before, the tooth just suddenly drops. Or the dentist say, this one bo pian, cannot save, have to extract. So that's the difference between the two. One is just the gums that can be cleaned away. The second one is the bones that is affected. Of course, the second one is a bit more severe. Usually, sometimes your GP dentist may say you need to see a specialist for treatment for that. Both are caused by the same thing. This is bacteria that goes in between the gums and the teeth. So just another picture for you to admire. The patient on the right side with the healthy gums is another patient of mine. I remember him fondly. He was about 84 when I took this photo. You can see that his mouth looks very clean. In fact, you wouldn't think that he's 84 if I didn't tell you his age. So once again, it is possible to maintain healthy gums, and not just by seeing the dentist, but making sure that you brush regularly and properly. Of course, there are other ways to prevent gum disease. Things like controlling your diabetes, which can lead to more chronic inflammation of the gums. If you control your diabetes, that gum inflammation can be reduced a little bit. If you are smoking, do know that that is also a risk factor for gum disease. For some of us, we may know of someone who is not able to hold a toothbrush properly. So on the photos on the right side show just what we call a modified handle of the toothbrush. You can see this is all regular toothbrush, nothing special, but very smart people put things like plasticine and Play-Doh or a tennis ball, or even wrap a towel around the toothbrush so that it is easier to grip the brush and to continue to brush. For some of us who may know of someone who is not able to brush their own teeth at all, then having to brush for them might be the choice. It is important that we continue to maintain the oral health of ourselves and our loved ones so that we are able to reduce things like decay and gum disease from happening. A little bit about dry mouth now. So just a quick question again, taking multiple medications can lead to dry mouth. Well, the answer is true. Things like high blood pressure medication or medication that has led to, for patients who may have had radiotherapy to the head and neck region, this can lead to dry mouth where the salivary glands don't produce so much saliva. It's actually quite common in the older adult group. We do see about 20% complaining of dry mouth or feeling that they have dry mouth. This is due to the lack of saliva in the mouth and other conditions such as Sjogren's syndrome. If you've not heard of it, it's just where the glands in the body don't really function so well. Certain medications, like I shared just now, and radiotherapy, sometimes even caffeine and alcohol can lead to dry mouth. Of course, sometimes you might find that your mouth isn't very dry, but your saliva is a bit thicker, or you're just not able to taste so well, or you feel that your lips are always very dry. Sometimes it may just be due to the lack of water. So sometimes if your mouth is dry like mine now, then it's good to take a sip of water every now and then. But what is the risk of having dry mouth? Well, this picture on the left shows another patient of mine. So he had radiotherapy before. And because of that, his mouth became very dry. Saliva is less in the mouth, and therefore food gets stuck more easily onto the teeth because, as you can imagine, it's not so wet anymore, not able to flush or wash away the food in the mouth. And because of that, bacteria begins to form decay on the teeth, and therefore, the whole mouth, if it's not treated early enough, can lead to a lot of quite bad decay. The picture on this right is not someone playing a fool. It's someone showing their tongue that is very dry. And this is can lead to a sensation of burning, sensation or a very stinging sensation on the tongue. So sometimes if this happens, the dentist may recommend some special mouth rinses just to reduce these symptoms. If you do find that you have a dry mouth, do see the dentist, and you're not sure why, do see the dentist for a checkup. They may give you some stimulants to help to increase the amount of saliva in the mouth. I mentioned some special mouth rinses. These you might have seen before at Guardian or Watson. It's not very cheap. It's of course more expensive than a regular mouth rinse, but they are more the moisturizing kind of mouth rinses, such that the mouth doesn't feel so dry for a couple of hours after using. Of course, if you are confirmed having a dry mouth, your dentist may increase the amount of fluoride I mentioned just now, things like special gels, just to reduce the risk of having decay. Finally, the other problem that I want to talk about is on tooth loss. This picture looks a bit funny, but it's actually a bogey auntie. So true or false again, I do not need to see the dentist since I don't have any more teeth. Well, the answer is false, and let me share why. Some patients, especially in older age, as we know, there is a higher risk of having things like oral cancer. And even if you don't have teeth, your dentist is trained to look into the mouth to make sure that these things don't happen so quickly. And if you have things like ulcers in the mouth, your dentist is able to pick it up early and can investigate whether or not it's something that's needed to be dealt with. So yes, the answer is you do need to see the dentist even if you don't have any more of your natural teeth. But look a little bit into tooth loss. What causes it? Why do we need to extract our teeth? This one is quite simple. Number one, of course, very bad dental decay. If you do have very bad dental decay, then no choice, right? The dentist say cannot save already, need to take out. The second one is, of course, gum disease. I mentioned just now, when the supporting bone around the teeth begins to wear down, where it begins to dissolve away, the tooth becomes more and more shaky, then it has to be extracted, or sometimes it even drops by itself. Some patients, unfortunately, if they fall, the tooth can get knocked out of the mouth, and then you become bogey at that area. And sometimes in the past, I don't know if you might be familiar, sometimes I have many of my patients saying, last time the dentist or the dental therapist say better to take out all your teeth so that you can make a nice set of dentures so your teeth are now straight. And we do have still a few more patients who have had this experience before. They do have very nice dentures, smile very nicely, but then after that they say, oh, then take out actually it's denture. Just to very quickly clarify, you don't have to wait until you got no more teeth to do a denture. Sometimes if you have missing maybe 3 or 4 teeth, we can do a small, or what we call a partial denture. So you don't have to take out any more teeth, but we will just fill up the spaces in between with the false teeth. So some problems associated with losing your teeth or tooth loss. Some of our patients, unfortunately, are no longer able to enjoy their favorite food. For example, some of our gentlemen here may enjoy beef or the occasional steak. With tooth loss, it's very difficult to chew. Even with dentures, sometimes it's still difficult to chew a good beef. Because of that, you may end up having to turn to softer foods, only eating fish, only eating very boiled chicken. Because of that, number one, there's a higher risk of malnutrition where you're not getting a good and well-balanced diet. Of course, secondly, you're no longer able to enjoy your food that well. And thirdly, you may feel less confident because your oral appearance or your smile isn't as it was last time, and you may even look different. And because of that, there is a chance that you may feel that you don't want to socialize as much anymore. As you can see in this picture, this lady here, because she has tooth loss, previously she eat broccoli like that, almost raw. After she loses a lot of her teeth, she has to switch to very boiled broccoli until it becomes very soft. As you can imagine, that doesn't taste the same, doesn't chew the same anymore, right? It's still broccoli, but it's very different. So what are the ways to replace missing teeth? As you heard just now, there are things like complete dentures. So this is that patient of mine. I said, we don't have any more teeth anymore, so we can do a complete denture, or what you hear the dentist say, a full denture, 2 big pieces in the mouth on top and below. Usually takes about 5 visits, sometimes maybe 6 visits to the dentist to fix, to take moldings, to take records, to take measurements, to choose the color before the denture is done. Of course, even after you have a set of denture made like this, it takes a while to adapt to it. Some patients feel that it is very uncomfortable, not used to it, not like their natural teeth anymore, and that is fine. Usually, we hope that patients will be at least patients will be happy 80% of the time with it, right? Meaning to say that if you wear the denture, so long as you give me 8/10, I feel happy already. It will very rarely be 10/10 because nothing beats keeping our natural teeth. I mentioned just now, if you are missing some teeth, doesn't mean that you cannot wear dentures. We can always do what we call a partial denture, where the denture sits in between the teeth. As you can see this picture here, only 4 teeth or 5 teeth in the middle are replaced. And then on top, of course, maybe a few more just to replace the missing spaces. The natural teeth still can be kept. Partial dentures, while they may not be as many teeth as a complete denture, still can take between 4 to 5 visits to make. And of course, similar to the other denture I mentioned just now, after wearing the denture, you may still feel very uncomfortable, pain, not able to chew properly or speak properly. It takes time to adapt and 1 or 2 adjustment visits before you can really be satisfied with the denture and enjoy your steak again. Another option to replace teeth is what we call a bridge. So you may have heard of this, or some of you may be aware of this. A bridge involves the trimming of the natural teeth to become a bit smaller, such that it makes space for a bridge to be fixed on top. The difference between a bridge and a denture is that a bridge cannot be removed. It is stuck and glued onto the tooth and requires daily flossing and seeing the dentist regularly to make sure that the natural teeth are still in good condition, strong enough to hold the bridge. Some patients prefer the bridge, and a lot of my patients will say, I want to do bridge and not denture, because number one, it is much smaller than a denture. It doesn't take up so much space in the mouth, and it really doesn't need time to adapt to it. Patients really like it. Unfortunately, it is not suitable for all patients. And of course, if you have too many missing teeth, a bridge will not be stable enough to be put into the mouth. So it really depends from person to person and having a dental assessment done. Of course, this one you will have seen advertisements before. Nowadays, clinics like to put big posters outside. Dental implants. It of course looks like a natural tooth. It functions like a natural tooth, and is even the size of a natural tooth. Patients really like it because number one, like the bridge, they don't have to remove to clean it. And number two, it feels like you got your natural tooth back again. As you can see the picture on this side, on the right side, we can even do a implant bridge where a few implants are put into the teeth, or put into the jawbone, and then the bridge sits on top of the implant. Cannot take out anymore. Very nice. On the left side here, for patients who have totally bogey already and wearing a complete denture, what we can do is we can put 2 implants and it becomes like a little click, like those button clicks, like your shirt. The denture can click onto the gums, click onto the implant such that it's no longer loose. It's very comfortable, and some patients really like it after that. However, I must share that implants is not for everyone. There are actually quite a number of contraindications or quite a number of cases that are not suitable for implants. For example, number one, if you have osteoporosis and you are on medications that treat osteoporosis, for example, Fosamax, those medications that you take once a week just to reduce the osteoporosis from progressing. These medications actually cause the jawbone to be at risk of not healing so well after the implants. So because of that, dentists will not be able to do an implant for you. Of course, some patients also in very senior and older years, as you feel your jawbone becomes smaller and smaller as we age, if the jawbone if there's not enough bone, the implant also cannot be put inside because, as you can imagine, there isn't enough support. And finally, if you are a patient who has had radiotherapy treatment before, also not suitable for implants because the wound and the implant may not be able to heal. There are a few other issues, such as patients who smoke or patients with very bad diabetes that may not be considered for implants. And of course, like bridges I mentioned just now, you do need to, it's a person-to-person, case-by-case assessment that the dentist will need to check. If you are wearing dentures, I thought to talk about it a little bit. So some common problems that are associated with dentures, there is poor oral and denture hygiene, where some of my patients surprisingly would wear the dentures overnight. I don't advise that because number one, all the food that is stuck underneath the denture and in between the teeth doesn't have a chance to escape. It doesn't let the gums breathe. It's the same as even saying I wear my socks the whole day and then after I go home, I go and sleep with my socks on. It is almost the same, and the smell you can imagine might even be worse. So if you are wearing dentures, do take note that it's not advisable to wear your dentures to sleep. If you do need to wear it for medical reasons, such as patients who need the dentures to keep the jaw open at night if you're using a breathing machine, or other reasons, then that's acceptable. But of course, do see your dentist regularly to make sure that the teeth are well maintained. It's important, of course, that you still want to maintain the natural teeth that's helping to hold the denture. Of course, other problems would be decay, like I mentioned, because the teeth that are underneath the dentures are not cleaned properly. Decay can quite quickly happen, as you can see in this picture here. 7 teeth all kena decay at the same time. And it's actually quite a lot of work to have to fill all these teeth at the same time. Other problems, if you wear the dentures for a very long time, it can lead to what dentists call denture stomatitis. It is just meaning to say that there is an infection of the gums, usually a bit of a fungus infection. Like I said, it's the same as wearing your socks overnight. You don't want to see what's in between the toes. It's also the same as wearing the denture overnight, and it can lead to a bit of fungal infection of the gums. Don't worry if you find that you might have this. Usually we advise patients just not to wear the denture at night. Before you see the dentist, you can always grab a bottle of mouth rinse. Rinse your mouth 3 times a day and also soak the dentures overnight in the mouth rinse to kill all these germs. Of course, the easiest one to show is when the denture is not well taken care of. The danger is not that there won't be any decay to the denture teeth, and the denture teeth wouldn't spoil just because it's not well maintained. What we are concerned about is that all these bacteria and germs that form and gather on the dentures are at risk of being breathed in, especially in very old patients who have who have swallowing problems. Sometimes you may accidentally aspirate or breathe in the bacteria that dislodges from the denture, and it may lead to infection of the gums. So therefore, we always stress that it's important to make sure that the dentures are well taken care of. I just show you this funny video of this 102-year-old lady whose denture is very loose, and because of that, when she blows her birthday cake, the denture flies out. It's funny and it's nice to share a laugh, but of course it is still we are still able to actually improve the retention of the dentures. Sometimes the dentist may need to add some more material by doing what we call reline. Sometimes we just need to adjust the denture a little bit such that it doesn't feel so big and obstructive. And of course, you will have seen on the TV advertisements of using Polydent and other denture adhesives available, denture glue, essentially, to help to stick the dentures on. Of course, there is implants I mentioned just now, but if all else fails, sometimes making a new denture may help. Unfortunately, sometimes 5 to 10% of our patients, even with a new set of dentures and trying all these things, doesn't improve the looseness of the denture. Usually upon assessment, we find that there isn't enough bone. I mentioned just now, as we age, our bones start to shrink. And when there's less jawbone left, then there is less support for the denture. And hence, even no matter what the dentist does, the mouth is just not able to support the denture. And unfortunately, for some of these patients, either they have to deal with a poorer set of dentures or they end up not wearing denture at all. So if you do have a set of dentures, finally, it's good to practice good oral hygiene and denture hygiene. So I'll just stress again, if you brush it, when you do brush your dentures, don't brush with toothpaste, because toothpaste inside has a little bit of those abrasives that may end up wearing down or scratching the denture. So it's important that you can use dishwashing soap like Mama Lemon. Think of it as washing a plastic spoon. It's almost the same as washing your plastic denture. Brush all the surfaces of the denture, the biting surface, the side, and even the inside, using a small toothbrush to make sure that you clean away all the dirt inside. Don't forget to brush your own teeth. Yeah. After you brush the denture, brush your own teeth with fluoride toothpaste. Yeah, as well as your tongue, to reduce the amount of germs in the mouth. And of course, don't wear your dentures to sleep. You can soak it in a container after you brush it, in a container of water overnight. And then the next morning after you rinse, you can wear it again. And of course, not included here, in between meals, it's good to take out the denture, rinse your mouth and wash the denture before putting it back on, just to reduce the amount of dirt that's there. I think with that, I just wanted to conclude with a few points. Firstly, oral health is important for your overall health, well-being, and quality of life. Feeling confident about yourself, oral health does have a part to play. I shared just now, and if you realize from all the slides, all these issues like decay, gum disease, they are preventable. Or if you have things like tooth loss and dry mouth, it is treatable. Make sure that you practice good brushing, as well as taking a healthy diet and visiting your dentist regularly. I must stress that not everyone needs to see your dentist 6 monthly. Sometimes some patients or some of us who are at lower risk of having gum disease or dental decay, your dentist may say, don't need to see me in 6 months, see me in 9 months, see me in 1 year, or see me even once every 2 years, just to check and make sure that you're doing a good job. So finally, your oral health matters even in older age. And of course, it's always important to make sure that you take care of your oral health and let your dentist help you every now and then. Thank you.
Wow. Okay. Thank you, Doctor. Thank you, Doctor, for the insights. I was just thinking aloud, because really, is it possible for someone can maintain the tooth, I mean their teeth, all the way until, to their last breath? Is that possible?
I think it is. It takes a lot of effort. I shared just now the 84-year-old patient with very nice teeth. It is possible to maintain your natural teeth all the way. Unfortunately, for some of us or some patients who may have a medical condition that ends up preventing them from being able to take care of their own teeth, these patients or these persons are at higher risk of having teeth problems, mainly because they're no longer able to brush for themselves. They have to rely on a caregiver. Usually for this, we try to also train the caregiver to take note of the patient's oral hygiene and to help brush regularly for them. So yes, it is possible, but it takes a lot of hard work, especially into the last 5-10 years.
I see. I think it's not just, hard work, of course, but I think it got to do with a lot of discipline, not just having this regular checks and brushing properly, but also in terms of the diet that we need to be careful.
Exactly.
So not an easy task. But anyway, thank you, Doctor, for the insights. Maybe, Doctor, are you able to stop share? Then I can just bring up.
Yes.
Okay, thank you, Doctor. Let me share my screen. Okay. Right. Okay, and can you see this? Okay, it's right. So for myself, I certainly enjoy the talk, Doctor. I mean, never noticed our teeth are so ugly looking. But anyway, but indeed, there's a lot of things that I myself really benefited from it. But I'm not sure about the rest. I hope that everyone has caught the takeaways as well. So before we proceed to the Q&A, there's a gentle call requesting for your help in completing our feedback and help us to continue to provide free webinars to all. Feedback will be conducted in a short poll that you will see on the screen about now. There are 4 multiple choice questions. Please take a minute or two to complete the poll. We will start the Q&A right after this, so don't leave yet. Thank you. All right, the polls are over. Thank you, everyone. Don't worry if you haven't finished voting yet, right? The feedback form will be displayed automatically after the webinar ends. Now let's get right into the Q&A. Gentle reminder to everyone to ask questions in the Zoom chat or the Q&A box. Okay, Doctor, I have one question came in much earlier. So this lady, Christine, actually asking, I'm having a lower right side sensitiveness rather than bad. Doctor advised nightly apply Sensodyne, Colgate repair and relief not help. And he even commented applied fluoride has said can last half to a year. Ultimately, no effect at all. Generally, is there a cure for sensitive teeth?
So that's thank you for the question. This was Miss Christine, right?
Yeah, that's right.
Yeah. So usually for us, and I think someone else also asked about sensitivity, so I will answer it at the same time.
Okay, great.
What happens is that usually over as we age, the teeth, the outer surface of the tooth, known as the enamel, or what is the white color part, wears down to reveal the underlying layer called the dentine, usually the yellow part. That's where it is very sensitive. So as you can imagine, having your teeth for over 60 years now, and you're brushing every single day very religiously, can actually lead to a little bit of a wear of the enamel. This is actually not too bad, but the sensitivity sometimes continues on. Dentists have a few tricks up our sleeve. Firstly, of course, using sensitivity relieving toothpaste, not just Sensodyne, but there are other brands available like from Colgate. By using these toothpastes can actually help to reduce the sensitivity because they form a little protective layer over the sensitive dentine. Some dentists also would recommend after you brush your teeth and rinse your mouth to put a little bit of toothpaste, like a cream, over the teeth and leave it there. Don't rinse your mouth after that. So once again, to form a little protective layer. If it doesn't work, the dentist also can put sensitivity relieving agents on the teeth, a bit of like a medicine for the teeth that they have in the clinic. Not every clinic has it, so you can always check with your dentist to reduce the sensitivity. Sometimes if the sensitivity is really unbearable, it may be due to the fact that there's a root canal issue. So once again, the dentist will have to check to make sure that there isn't anything, there's no infection into the nerve of the tooth. Hopefully that answers your question. I know sensitive teeth is a very, not very pleasant thing to deal with. And it's good to get it checked and to try some of the options out there.
Sure, doctor. So Christine also asked that her upper right one of the tooth have been fractured. Doctor suggested to do a crown or implant. She asked how long it will last.
Depends on the crown and how you maintain it. So for example, based on research, we know that crowns, 9 out of 10 crowns you can keep for up to 10 years without causing a problem. But of course, for some of us, some patients we have seen before who don't maintain the crown, meaning they don't brush around the crown properly, or they don't see the dentist for regular checkups, those teeth or those crowns end up failing much earlier because of things like decay or gum problems, and then end up the teeth underneath gets damaged. So ultimately, it's about how you maintain the crown. And of course, it's not just 10 years. You can keep it for 20. I've seen 20, 30-year-old crowns before. And it is due to patients, being very disciplined about how they take care of their teeth.
Okay, doctor. So Agnes, in the Q&A box, right, she asked how to treat dry mouth and what causes it. And she also asked food gets stuck in between teeth. Am I right to ask the doctor to patch the gap between teeth for me?
Hang on, I'm just answering someone's question.
Okay.
Yes, so if you do have dry mouth, I mentioned just now, there are some conditions that cause it. For example, some medications that you're on, or the fact that some patients might have had a history of radiotherapy that leads to a very dry mouth. In order to solve it, you can take regular sips of water. If not, then the use of special mouth rinses that lubricate the mouth may be prescribed by your dentist. I see that Miss Agnes also asked if food gets stuck in between the teeth, can they patch the space? Unfortunately, unless it's a decay, then they will do a filling. If it's a natural gap between the teeth, then you would have to be responsible to floss it, because we are not able to patch in between teeth. Hopefully that answers the question.
Okay, good. Christine also asked,
I think, I see that. Maybe I'll take that question also. It's interesting. So is it possible to do a denture for one tooth? So for some, we have had before, if you're just missing one tooth, there are, like I mentioned, several options available. And denture, yes, is one of them. You can do a very small denture to replace that tooth, and your dentist would be able to guide you a bit more on how to do that. Otherwise, of course, there are options of bridge and implant that are also worth considering.
Okay.
So Miss Winnie Tan asked, can osteoporosis patient do bridge since they can't do implant? Well, the answer is yes, but it depends again based on the assessment of your dentist. For example, if you only if you have too many missing teeth in the mouth, sometimes a bridge cannot be done because your natural teeth or your remaining teeth not strong enough to support the bridge. So it really depends on the state and the condition of your remaining teeth in the mouth. I like this other question. Minimally, how many teeth in order for proper food chewing? Firstly, it is really up to you, depending on what you feel comfortable with and what you're able to be able to enjoy your food, enjoy your meals and socialize. But if you want to put a number, for us, the number that we normally recommend is to have 20 teeth in the mouth. In Singapore, we do have the National Dental Centre that has been advocating for 20 teeth at 80 years old, meaning to say that for our Singaporeans who are at 80 years old, we want to keep at least 20 teeth. We still want to make sure that they have 20 teeth in the mouth. Because 20 teeth means that on top and below, you have 10, you at least have 10 on each side to be able to chew and enjoy your food still. But of course, if you have less than that, you're still able to chew your food, then it's really from individual to individual. I see a few more questions. I'll take Ms. Kim Chan's question. Her mom is 87 years old on complete denture and needs to see a dentist, and any dentist will do. Complete dentures, I shared just now, they may not be very easy, especially in patients that have very receded or very resorbed bone. That means, especially in older age, I would imagine at 87 years old, sometimes the bone may not be sufficient enough to do a denture that well, and it becomes very loose. Some dentists may find the need to have to refer such patients or such dentures to a more experienced dentist or a specialist. So, of course, you can see any dentist first to make the assessment. If they feel that they are able to provide a good set of dentures, they will do it. If not, usually the dentist will be responsible enough to refer you to someone that they trust to be able to do it. Maybe we have time to take a few more questions. Someone asked what dentures made of. I'll just quickly answer it. Dentures are primarily made of plastic. But there are two kinds. One is the fully plastic denture, and the other one is the partially plastic combined with some metal, or what we call cobalt chrome. Both don't have any side effects, and they both have their advantages and disadvantages, but both are durable, especially if you use them well. I would advise patients who are wearing dentures not to chew on hard things like shells, nuts, ice, bones, because plastic teeth are not going to be as strong enough as your natural teeth. Ms. Barbara also asked what is receding gum and how to prevent it. Usually, receding gums is when the gums shrink away from the teeth, and this is due to two reasons. One, it may be prolonged gum disease, so good to see the dentist to get it treated. Sometimes it may be due to very strong brushing. So usually I advise almost all my patients to use a very soft bristled toothbrush and not to put too much force on the gums. It's good to brush the gums, but not to force them down. There are still a few more questions. I'm happy to take them. Mr. Ian says, someone told me that I should not brush my teeth too often because the saliva can mineralize the teeth. Saliva, you will see the main mineralization of the teeth coming from. And of course, it is important to brush away all the food stuck on the teeth. So only the toothbrush can do that. Unfortunately, our tongue cannot. Someone asked that after I've rinsed my mouth with mouth rinse or mouthwash, should I rinse with water again? The advice is usually no, because in mouthwashes, for example, once again, fluoride mouth rinse, you would want the fluoride to stay on the teeth for a while more so that it can be absorbed into the tooth rather than quickly rinse away with water. Someone asked also whether wisdom teeth should be removed for adults. Well, if they're causing you problems or if your dentist sees that it is necessary, then yes. For some of us, we have seen patients who have kept their wisdom teeth all the way into their late 80s and not causing them a problem and even helping to chew. So it's really a case-by-case basis. Someone asked if it's good to use salt to brush your teeth. I've heard this before. Even things using like melon salt or coconut oil to brush teeth, wouldn't advise it. Number one, salt is very abrasive. And number two, it doesn't contain things like fluoride that will help to strengthen the teeth. So why not just use toothpaste? Someone says fluoride is poison or drinking water has fluoride too. Yes, Singapore's water is fluoridated. Tap water and drinks made in Singapore, any drinks that you buy from the coffee shop is also fluoridated. And it's actually at a very safe and very, very minimal amount. In fact, the current amount of fluoride in our water is almost half or even 1/3 of that 20 years ago. So fluoride in Singapore, water in Singapore is fluoridated, However, it is nowhere near what it used to be. And at the same time, it's nowhere near any dangerous levels. You can drink all the water you want, and the fluoride is not going to harm you.
Okay, Doctor, maybe for time reasons, maybe you'd like to just
Yes.
answer the last three questions, if that's okay.
Last three questions, sure. So we'll just take the first one. Miss Anita asked, is it necessary to use special kind of cleaning agent to clean the denture? If you are using those cleansing tablets you put into the water and it fizzles and you leave the denture inside, yes, it helps. But it's also, if you're able to grab a toothbrush and soap to brush the denture, that is still the best way to take care of your denture. Someone asked whether you can brush your teeth with baking soda. I shared this just now about the salt, so I'll just move to the next question. What's the difference between Dali and Colgate? There's no difference. It's in fact, if you Google it, it's owned by the same company.
Oh.
And finally, is it good to brush tongue with toothbrush? Yes, it is, because the tongue also contains all the bacteria that's stuck on it. It's good to brush, especially not just to reduce the bacteria, but to have to avoid bad breath. I think that's all the time Melvin is going to allow me to answer questions. Yeah, we'll just stop here. Thank you so much, everyone, for many, many questions.
Yeah, thank you, Doctor. Yes, you are right. That's all the time we have for tonight. So, Doctor, may I just check with you? Do you have any last words of advice to add before I conclude?
Yes, of course. Let me just quickly share about usually one very common question, which I have not seen today, is where can I see the dentist at? For myself, just now you might have seen that I work in NUH, but it doesn't mean that you need to always see the hospital just because there may be the specialist there. For example, if you just need a routine checkup, you can either see the polyclinic, or why not consider seeing your private dentist. If you are holding a CHAS card, such as the CHAS Blue or CHAS Orange, you can receive government subsidies that will cover your consultation, that can be the same price or even cheaper than the polyclinic. If you are having a Merdeka or even Pioneer, check with the dentist. Nowadays, even you go market, you walk past 3 dental clinics, pop by each of them and just see whether they accept your Merdeka or Pioneer card. And if they do, you can always ask them how much is it for a checkup. And you'll be surprised that it can be, once again, the same price or even cheaper than the private clinic, than the polyclinic. And why not? Because it is convenient for us, if it's convenient for you, and also a shorter waiting time. Of course, if the dentist feels that they need to refer you to the specialist, then most of the time they will refer you to either NUH or the National Dental Centre to get it sorted out. Yeah.
Okay. All right. A big thank you to you, Dr. Gabriel, and our wonderful online friends tonight. We hope you enjoy our talk and found it useful. Now, let me just do a quick recap about our services. At Sage, counseling is free for Singaporeans and permanent residents. You can call us to find out more. We also have the seniors helpline, a free national helpline with an easy to remember number. That is 1-800-555-5555. Okay, and here we are. We have just a short announcement for next month, the talk entitled Hearing Loss and Healthy Aging. We are honored to have an NUH senior audiologist to share her expertise. The talk will be on 20th July, a Thursday, same time, 8 p.m. on Zoom. And this time round, you'll be bilingual in English and Mandarin. Registrations are already open, so you may visit the link to sign up. I think I will put the link in the chat box now. Okay. For more updates on our activities, do follow us on Facebook page, and for any other questions, we are only just an email or phone call away. Thank you once again for joining us, and have a good night, everyone. Bye-bye, everyone. Doctor, you may want to leave if you want to.
Thanks, Melvin, and thanks everyone for having me.
Okay, take care. Enjoy yourself.
Okay,
Bye-bye.
thank you. Bye-bye.
you.